Good morning, everybody.
Good morning.
My name is Sarah Kelly Palmer,
And I'm Kayla David.
and Kayla and I wanted to take a moment this morning just to take a breath and to reflect on and just acknowledge the impact that systemic racism in our country and the needless and senseless killings of people of color.
These acts of violence, they're shocking and horrific, and yet they're disturbingly familiar in our country. They're part of our shared narrative, of a national narrative of discrimination, marginalization, and oppression of people of color. And as a community, we must make a change to not only acknowledge racism, but to fight against it. And as an agency, we wanted to let you know that FSRI is committed to this action. We will continue to provide the needed services for Rhode Islanders, while also working on state and national levels to advocate for equity and justice within our systems.
Thank you, Kayla. For those of you who this is your first time joining us here on Facebook Live, Kayla and I are part of the healing department at Family Service of Rhode Island, and we come here once a week. And we do so to share various topics and information to help us all as a community cope during this COVID-19 pandemic. Family Service is a social service agency, and we have been around for over 125 years serving all of Rhode Island. And we have a variety of different programs, one of which includes telehealth counseling. It's now so much more than ever. It is really important for us to focus on our own mental health and to help support our loved ones and friends to focus on their mental health just as much as we've been focusing on our physical health. And just to let you know, we are here to help with that.
Yes. And so we'll be joining together today and every Wednesday at 10 a.m. for discussions that support wellness during COVID-19. So we would love it if you took a moment to share this with your friends or to start a watch party. We really want to reach as many people as we can with this important information, really to kind of reiterate that message that it's just as important to focus on our mental health as it is to focus on our physical health in times of kind of mass pandemics or in times of extreme national stress and tragedy. So please share this and get the word out, and know that COVID-19 has put a great deal of stress on all of us in so many different ways, and it continues to impact our communities, it continues to impact our families and ourselves, and that impact hits us in terms of our well-being and our mental health as well as our physical health.
Today, we're going to focus on a discussion around the impact of COVID-19 on domestic violence. So, thinking about in the context of this pandemic, we're now really experiencing the outside world as a place that is not as safe as it once was for our physical health, right? We're asked to stay home as much as possible. We've been asked to limit our contact with friends and loved ones. And until very recently, we really haven't had access to in-person supports or our communities that we all once relied on to support us. And it's in this context that we have to acknowledge that home is not a safe place for everyone. And that's what brings us to our conversation today.
Yes, so we are very excited to have a special guest on with us today, Tanya Harris, the Executive Director of the Rhode Island Coalition Against Domestic Violence. Welcome, Tanya.
Thank you. Hello, Kayla and Sarah. Thank you so much for having us.
Hi, Tanya.
So Tanya, we are so grateful to have you on here today and talking about domestic violence. And I know for some people, it might be a surprise that we're talking about this. For others, it's such a pertinent conversation and one that needs to be had and information that needs to be shared. And for those of you that do have questions throughout this, please don't hesitate to use the chat box and ask your questions, and we can certainly answer those, and we can ask some of Tanya to answer them too. So Tanya, we thought we would start by having you share with us a little bit about the Rhode Island Coalition Against Domestic Violence, the mission, and what you do.
Sure, thank you. So the Coalition Against Domestic Violence mission is to end domestic violence. And it was formed in 1979. And it is a agency, a coalition made up of member agencies, affiliate member agencies. And we convene members, and we also provide guidance and leadership on domestic violence matters throughout the state. Our agency services consist of counseling, support systems, advocacy for legal matters, court advocacy, and of course, emergency shelter beds for victims and children who are fleeing from violence.
Thanks, Tanya. So we've been hearing so much in relation to this COVID-19 pandemic. And one thing that we're hearing both kind of nationally and internationally is that there has been an increase in domestic violence during this pandemic. So we were wondering if you could just kind of talk to that. And is that true for us here in Rhode Island? Are we seeing that in our state?
Yes, we are actually. And while we would expect that to happen, because nationally we are seeing that there is an increase in calls and incidents of violence, so we'd expect that here in Rhode Island. We have seen a 40% increase in our helpline and hotline calls in the month of April compared to this time last year. And important to know, I think, for everyone to know this and understand that numbers don't typically tell the entire story, right? And so increase in numbers can certainly be a couple of things. Increase in numbers can mean that there are more incidents of violence, of course, right? And on the other side of it, increase of calls can also mean that people are more aware that it's happening and victims are calling more, right? And that education and awareness is out there more. And also that other people are calling about it and other people are saying, I think that this might be happening, or referring other people. So it's really important to keep that into context, that numbers definitely don't tell the whole story. And more importantly, and just as importantly, I think that the helpline number, our 1-800-494-8100 confidential statewide helpline, is for victims to call and also for others who are seeking information, who might just want to know, hey, I think that someone might be in an abusive relationship. What does that look like? And so they can speak to advocates about that process. So it's for victims and for others who are seeking information.
Well, and Tanya, I'm just wondering, just to back it up, because I'm just realizing, right, the three of us all work in this field. So when we say domestic violence, I think we know what we're talking about, but there might be people out there watching us that might not really know what that means, or when we say domestic violence, what does that refer to? So I'm wondering if you could just kind of share with us what we mean when we talk about domestic violence.
Sure, great question. Thank you so much. And so domestic violence is, the dynamics is about power and control, right? And so it's about one person having complete control over the other person. And so it's a great question, Sarah, and a great thing I think to bring out, because it's an opportunity for us right now to speak directly to the person who may not know. So I say to the person who might not know that you're in an abusive relationship, if you are fearful of your partner, if you're walking on eggshells around your partner, if the person scares you, makes you feel uneasy, uncomfortable, or has exhibited in any way, verbally, emotionally, psychologically, or in physical in any way, or who tries to control every single part of your life, or even a small part of your life, you may be in an abusive relationship. And so please reach out to our helpline. Please reach out to the helpline. An advocate can talk with you and can walk that walk with you, right? And so can also refer you to an agency where an advocate can talk to you about these dynamics of abuse, and then provide a safe way for you to leave the abusive relationship if it is a shelter. And some might not be a shelter, right? Every walk is individual. Every single domestic violence victim is different and should be handled differently. And so what works for one might not work for the other.
Tanya, thank you so much. And Sarah, thank you for that question, because I think we talk about it like we know, and yet we want to make sure that people do understand and are aware, because domestic violence is complex. And there are so many people that might not, think just because I am fearful of my partner or they have control over my phone, I can't be in a domestic violence relationship, because it's not physical, right? And in fact, it's so much more than that, in terms of kind of financial violence, in terms of emotional violence and control. Thank you, Tanya. So research has shown us that in times of national disaster, so we saw this in 2018 with Hurricane Harvey, we're seeing that today with COVID-19, that there's an increase in domestic violence and that there's an increase in intimate partner violence. What do you think are some of the factors that contribute to that increase during times of national disasters or crisis? What kind of leads to those higher numbers?
Yeah, so important to lift up and recognize, in particular during this time, the immense fear of survivors who are being abused right now, right? Mm-hmm. It's just really important to, I think, to mention that, because as we said earlier, home is not a safe place necessarily for everyone. During COVID-19, the message has been, stay home, it's safe. However, if you're a victim and you are living with your abuser, home is not a safe place. Domestic violence does not take a break. Whether we're in COVID-19 or not, domestic violence still happens. So some of the concerns for us is that we want everyone to know that we are still open. We're still here. Our shelters are still open. We are still providing a safe space for victims. Our courts are still open, and some people are unaware of that. Victims can still go to the courthouse. Our advocates are working in the courthouse. They remain in the courthouse to help navigate victims through the very complicated court system. So obtaining a restraining order can still happen. We will also want to lift up that it's also a time for abusers where they are using COVID-19 as a further intimidation factor to victims. And so what that can look like is that the abuser can further intimidate the victim to say, well, don't go outside because it's really unsafe, because you might get sick. So stay inside. So now the victim has less access to the usual support system that they might have had access to, right? And so children are home from school, and children are certainly now witnessing and may witness more incidents of abuse. And we know those have long-term effects on children in their psychologically, of course, in poor academic performance. It can play out in substance abuse and behavioral issues. So we know that's certainly an effect that this can happen. And the financial implications, financially finances are one of the ways and one of the barriers that victims face every single day when deciding whether or not they are going to leave the abuser. And a quick example would be the stimulus checks that we just sent out recently. Right. And so if I have fled my abusive relationship, I no longer have access to that stimulus money. And that money could have been life-saving. It could have meant that I could have been in my own apartment with my children, or it could have meant that I provide food for my children. And so now I no longer have access to that. So these are some of the concerns and some of the things that we want to make sure that we're monitoring, that we're watching closely. We want to make sure that survivors and victims are aware that we are a resource, that you can reach out, and that we are certainly open every single day. Our advocates are working tirelessly to meet survivors and victims' needs.
Well, for that, you guys are essential workers, so thank you to everybody that is doing that. And you mentioned, Tanya, kind of abusers kind of using COVID-19, right, as a tactic. You mentioned kind of that financial implication. Are there any other additional or unique struggles that you're seeing because of the pandemic for somebody that might be looking to flee a domestic violence situation, other than that what you mentioned?
I think there are many barriers. And so what COVID-19 has done has magnified the barriers, right? And so in addition to the financial, it's the lack of affordable housing, right? So it's okay. So I've left the abusive relationship. The victim has done that, and now I can't move because I don't even make minimum wage, and so I can't move into an apartment, or I can't now, instead of going to a shelter, what can I do, right? And so it's the same type of barriers that victims are facing. The barriers exist pre-COVID-19. They'll exist during COVID-19 while they're magnified, and they'll continue to exist. It's almost like a bottleneck effect, right? And so what we're finding is that victims are staying longer in shelters because there's less affordable housing. And so it stops new clients from coming in, of course, and they're staying longer. And then, of course, now where am I going to leave after I'm out of the shelter? What do I do at that point? So it's really systemic. It's long-term issues that we are advocating for on the coalition level at all times, of course, advocating for legislatively to make sure that these types of barriers services don't exist for victims. Shelter capacity has expanded, however, and so we have been working with the governor and have received funding so that we have additional shelter bed capacity. So the message we want to make sure we communicate to victims is to please call that helpline number, that 1-800 number, because an advocate can work with you. If you are fleeing an abusive relationship, we can shelter you in a safe space.
Tanya, thank you. And I think one of the things you said really struck me, which is that, all of our systems are kind of really webbed together, right? There's such an intersection between these kind of issues in terms of our housing, in terms of our kind of systems of care. And also domestic violence, it doesn't happen in a vacuum, right? It's impacted by all of these other systems, and that those systems have been impacted by systemic oppression and systemic racism. And we know on one hand that domestic violence happens in all of our communities, amongst all classes, all races, all religions. It happens to all genders. But we know that it's impacted by other forms of oppression, like systemic racism. And I wonder if you could speak a little bit to how, systemic racism and oppression might create unique sets of challenges for those in minority communities who are victims of domestic violence.
Sure. And Kayla, you're so right that, I say this quite often, that domestic violence knows no zip code, right? It doesn't make a difference where you live, who you are, what your race is. Anyone can be affected by domestic violence. However, to your point, racism affects all aspects of a person's life. It certainly does look different for a woman of color than it does for a woman who is not of color. And for women of color, where they're experiencing higher rates of poverty, they might not have the same access to education, the fear of deportation. And so if I call the police or if I seek a restraining order, am I going to be deported? And then what happens to my children, right? So those are the added things, language barriers. And so for some people, calling the police is not the safest thing. They don't feel that's the safest option. And so for these reasons, it will look different for women of color who experience victimization at a much higher rate than women who are not of color. And so we have been engaged at the coalition since the early 2000s in ways to examine how we provide services, and so that we provide them through lenses that are anti-racist, that are anti-oppression. And there is, one of the core purpose statements that we've adopted is to focus on, down to the very last girl. And so what that means, what that can look like, is to make sure that we're centering our strategies on people who have been left out typically, right? So people who have been left out of the table, left out of the conversation, people who are not in the boardrooms. And so we want to make sure that we continue to lift this population so that racism and oppression is not a factor for the very last girl.
Tanya, I absolutely love that kind of mission statement of really making sure that we're centering voices and just that idea that we have to look at every girl and I love the word girl in that statement, because we are looking at the next generation when we're doing this work, right? That doesn't happen in a vacuum either. And we know that this is a long, to make sure that domestic violence doesn't happen to anyone, we have to look so far into the future with the way that we approach our treatment and our care, and the way that we look at traumatized systems and trauma-informed or trauma-aware care in our systems of care. That was care a lot.
Yes. No, the hope is that the generations to come can live in a world free of violence. And so my hope is that I have an 8-year-old granddaughter, and my hope is that she can say one day that she has lived in a world and had a life that is free from violence. And so, yes, that's absolutely the hope.
Tanya, you spoke a little bit to this, but I think it's really important when we are talking about Rhode Island, we're talking about resources, because COVID-19 has impacted housing, shelter, access to food, access to supplies, access to services, and that those were scarce before COVID-19. We know that we were in a housing crisis prior to COVID-19. We know that we never had enough funding for all of the support services that we actually needed statewide. So I wonder if you could share a little bit about resources that are currently available in Rhode Island for those seeking shelter or advocacy, and some of those partner or affiliate agencies you were talking about. And if there are, those that are for everyone, but also when we think of male survivors, or we think of people who are in LGBTQI relationships or same-sex relationships, we know that those resources are even more scarce for those populations. So I was wondering if you could speak a little bit to the resources we have in Rhode Island.
Sure, absolutely. So again, message that I quite frequently want to make sure that I share, that we are here and we are open. We are here and ready to meet your needs. And so our shelters are open. Reach out to our helpline, reach out to any one of our member agencies. If you're fleeing an abusive relationship, our advocates are working. They are working remotely, with the exception of our court advocates who are at the courthouse navigating with victims. However, the advocates are working remotely and providing counseling for adults, providing counseling for children. That is all still in place. We've expanded resources. And so we, in addition to the 24/7 helpline hotline, we also have expanded our chat online service, which is available through our website, where a victim can access 24/7 and advocate immediately in order to seek assistance. And also there's a text to 911 option. And victims, if they provide their location, will be able to have the first responder come to them right away if they're in need of assistance. And it's also, a great time for us to check in our neighbors more often, in particular during COVID-19. And also, in particular, if you are aware that the person has been in an abusive relationship in the past, check in on them more often, text them, call them, reach out if you can. It's really important for us to just be more, I think, alert as Rhode Islanders, and more aware. And of course, if you're seeing abuse happen, or if you are here abuse happening, to please call 911 immediately and let the law enforcement officials respond.
Tanya, can you speak a little bit to that text 911? Because that is something that I don't think many people know about, and it does help so many of our community, whether it is that you can't be seen on the phone or you are hearing impaired, and that's been a huge barrier to accessing kind of response or 911 responders. Can you speak a little bit to how that works if we were to text 911?
Right. So it's my understanding you text in 911, you put in your location, and the first responder comes right to that location. It's that easy. And so it's a wonderful resource for victims. And so, in particular, when you think about the victim who is sheltered in place and sheltered at home, it may be that one chance that they have access to their telephone, because we know that abusers now are over their shoulders more, right? And so it might just need to be a really quick response as opposed to an actual phone call. The chat online is really effective for that as well, because it may be that the victim doesn't have access to the phone to be able to speak on the phone, but maybe can chat and send a message, I need help, send help with a location. So we've thought about these things and tried to expand services to provide for the fact that we are aware and know that shelter in place provides more access for the abuser to the victim.
Yes.
And Tanya, I love that, that the coalition has really kind of risen to this occasion for the community. And we've had, I think, the same experience where we've had to get creative really quickly, right? And that COVID-19, while it's having many impacts, kind of negative impacts, I think also for agencies, it's really been an opportunity for us to think creatively and, like you're saying, expand services or do things differently in ways that we maybe never thought of before. So, it sounds like the Rhode Island Coalition Against Domestic Violence is doing a lot of kind of creative techniques to engage survivors. So, so you've talked a lot about how this has impacted your work. I'm just wondering, do you see some of this continuing beyond COVID-19?
Interesting question, right? I think that's something that a lot of agencies are thinking about, right? What worked and what doesn't work, or what can we keep and what can't we keep? I'd like to just circle real quick back to the other part of Kayla's question in regards to the services for men and LGBT community.
Yeah.
And so, yes, absolutely. And so we serve all clients of domestic violence. And so if you are in the LGBT community, if you are a male victim, please reach out. And we provide services to those communities as well. And I just want to make sure that I circle back to that. But Sarah, yes. And so we are the coalition, and in particular the agencies who are providing the direct services, would be remiss if we didn't have those conversations, right? And to think about what works and what is working well. And so, the remote may be challenging at times for victims. Of course, it's different. It's a different way to communicate, right? As opposed to in person. We think in person is always better to communicate with victims. However, is that something that we can look at for future if the victim is not able to meet with us, right? And so I think all agencies, including us, I know we certainly will, look at COVID-19 and some of the systems we put in place and some of the policies we put in place to see, hey, did that really benefit our clients? And if it did, let's think about keeping that, or let's think about enhancing that particular policy that we put in place. So yes, I think we definitely would.
And, Tonya, for one of our final questions, so many people, I'm sure, contact your line or come up to you and ask if I'm a friend or a family member of someone who's living in a domestic violence situation. It can be a really difficult thing, right? As a friend or a family member and bearing witness to or hearing the stories of domestic violence. What would you say to those friends and family members about how they can show up for their friends and family members, how they can support them, or how they can be helpful?
Yeah, so it's really important when you are speaking with someone who you believe is in an abusive relationship to listen to them and to listen to them without judgment. And, what we talked about earlier was that every victim of domestic violence is different and unique, and their situation is different and unique. And while the person hearing may want to say or may believe, well, let's just leave, let's just go. It may be more complicated than that. Domestic violence has many complications, is dynamic. And so it might not be the safest time for the victim to leave the abusive relationship, which is why the person who is hearing or believing that this is happening should be ready to provide the 1-800 number, ready to provide a referral to one of the agencies so that an advocate, a trained advocate, can walk this path with the victim and determine if leaving right now is the safest time, to determine, what the other options are, to determine another space. Is there a family member that the victim wishes to go to as opposed to a shelter? Shelter is one option, and it's a wonderful option. However, it's not the only option. And the saying is, the victim and the survivor, they drive the train. They're the ones to determine what happens in their lives. And so we have to recognize that. And so to the person who is trying to help, continue to try and provide help, but be at the pace of the survivor or the victim, and listen to them without judgment, and be ready to provide those resources and referrals to the victim. And again, I'll say that if you hear domestic violence or if you see it happening, to call 911 immediately.
Tanya, that is so important, because I do think some people will say, I don't know what to do. I don't know how to help. And I think that reiterating, okay, have the phone numbers ready, get them to people that know how to help, right? And just actively listen and be humble and not, make judgments. That is so vital and so important, because those judgments that we make when someone maybe isn't ready makes it so that it's so much harder for them to come back to us when they need us, or when they can activate their support system. So thank you for that reminder to everyone, that it just takes some active listening and knowing a few resources in our community, and making sure that, maybe we call together so that it's not as scary, or can we go post COVID-19, can we go there together so it's not so scary? How can I support you? And again, that train is being driven by or conducted by the person that is in that situation.
Yes, definitely.
And we're so lucky, Tanya, to have the coalition here in our state. So you've mentioned the helpline. How else can people get in touch with the Coalition Against Domestic Violence here in Rhode Island? What other ways?
You can call us directly at 467-9940, and we can certainly refer you or provide guidance or give you information or tell us. We can certainly give you more information about us. You can check out our website, www.ricadv.org. And we also have on our website a COVID tab. And so we have an abundance of resources there about COVID-19 and different things that we've been spoken about today here during our time. And follow us on social media. We have wonderful resources on our social media as well.
Great. Tanya, thank you so much. We are so grateful to have you on and talking about this important topic and talking about the resources that are available in Rhode Island for those that are victims of domestic violence. So thank you so, so much. And thank you to everyone that was watching and everyone that's watching later. We look forward to coming on each and every Wednesday to speak about topics related to COVID-19. And we will see you again next Wednesday at 10 a.m. So thank you and be well.
Thank you. Thank you, Tanya. Take care.